Om Swastiastu, hello doctors and friends. We are from SGD B8 would like to present our student project with the title Effects of Reiki on Mental Health. And this paper contains an overview about effects of Reiki on mental health from the introduction, definition, history, application, techniques and methods, benefits, scientific evidence, potential side effect, and conclusion. These are the members of SGD B8. And first of all, let me begin the presentation. My name is Gusti Agung Ayu, Adinda Fidelia Putri, with my last digit of student numbers are 232. So today I will going to explain about the chapter 1, Introduction. 1.1, the background of effects of Reiki on mental health. Mental health is a critical component of overall well-being, and about 1 billion individuals worldwide suffer from a mental health issue, and in developed countries, mental illness makes up half of all the illnesses among those under 45 years old. And Reiki, a Japanese holistic healing practice, has gained attention because of its purported ability to improve mental well-being. Reiki was developed in the early 20th century by Mikao Usui, a Japanese Buddhist, and Usui claimed to have received the healing technique during a spiritual meditation of 21 days on Mount Kurama in Japan. Reiki is considered to be safe, affordable, and non-invasive. According to early study, it may be effective in treating a variety of conditions, including symptoms of mental health. Reiki works to restore the client's energies back into balance on the physical, emotional, and spiritual levels, and therefore improving the client's natural ability to heal. Well, I think that's all for me. Thank you.
Hello, my name is Indyarwan Ananta Seno with last digit NIM 091. Problem formulation. The problem formulation of our student projects are: what is Reiki? What is the history of Reiki? How is the application of Reiki? What are the techniques and methods of Reiki? What are the benefits of Reiki? What is the scientific evidence of Reiki? And what are the potential side effects of Reiki? 1.3 Objective: to know the definition of Reiki, to know the history of Reiki, to understand the application of Reiki, to know the techniques and methods of Reiki, to know the benefits of Reiki, to know the scientific evidence of Reiki, and to know the potential side effects of Reiki. The benefits: theoretical benefits, to obtain information and provide new understanding about Reiki and obtain references for further research. Practical benefits: to enhance medical skills, including the management and education to patient through the theory acquired in this study. That's all from me. The next part will be explained by my colleague.
My name is M.Si, with the last digit of my student number is 074. I will explain about the chapter 2, content. First is definition. Reiki is a Japanese alternative therapy that utilizes energy as a means of healing. The origin of the word Reiki comes from the Japanese language, where Rei means universe and Ki means the flow of energy in living beings, depicting the energy of the universe. Reiki therapy involves the channeling of energy into a patient's body through the hands of a Reiki practitioners, often used in conjunction with medical and other alternative therapies like aromatherapy, herbal medicine, neuropathy, and psychotherapy. Reiki can be applied by individuals to themselves, known as self-Reiki.
My name is Adjani Sayidina Pakpahan with student number 031, and I would like to explain the history of Reiki. Originated in Japan in the early 1900s, Reiki was founded by a Buddhist monk named Dr. Usui during his monastery training. Then he opened a healing and teaching clinic in Kyoto, where he started treating patients and training others, quickly introducing Reiki to all of Japan. Dr. Usui then passed his teachings and knowledge to Dr. Chujuro Hayashi and Madame Hawayo Takata, who is widely recognized as being the person who brought Reiki to the West, by opening the first Reiki clinic in Honolulu, Hawaii. Reiki practitioners today still use the techniques created by Usui Reiki creator Dr. Usui. And that is all from my explanation. Thank you.
Thank you for the opportunity. My name is Rosevelani Manasai Budihardjo, with the last three digits of student number being 168, and now I will be presenting about the application of Reiki. So, Up to 1 billion individuals worldwide suffer from a mental health issue, and therefore there is a need to identify low-cost, safe, and evidence-based methods to lessen the load. Reiki is considered to be risk-free, affordable, and non-invasive, and is useful in treating a variety of conditions, including mental health problems. Reiki enters slowly, progressing the hand positions over the front and back of the clothed body while gently placing the hands just above or on it. An authorized therapist uses this technique to remove toxins, balance the body, supports the body's optimal functioning, and restore the flow of life-giving energy by touching or approaching the hands. Reiki works with the energy that guides the body into a more relaxed condition that is associated with healing. Reiki can result in a profound release of emotions or energy that restores the body's natural energy flow. Patients typically report feeling more at peace, well being, or having more clarity. That's all from me. The presentation will be continued by my friend.
Hello, my name is Nikita Devi Prasiti with last three digit of student number 028, and I would like to tell about the techniques of Reiki. So Reiki is a hands-on energy healing technique that practitioners use to promote emotional and physical healing. Practitioners believe that they can transfer a universal energy from their palms to the client to promote healing. The Reiki procedures are typically performed in a calm and quiet environment, and the client is fully clothed and sitting or lying down. The practitioner will lightly place their hands on or over specific parts of the client's body, including the torso, limbs, and head, for 3 to 10 minutes. If there is a specific injury, the practitioner will place their hands slightly above the wound, and the Reiki practitioners believe that an energy transfer occurs when they place their hands on or over the client's body. The practitioners may feel tingling or heat in their hands during this time. They will hold each hand position until they feel that the energy is no longer flowing, and then move their hands to another part of the body. That's all for me. Thank you.
Thank you for the opportunity given. Hello, doctor and friends. Let me introduce myself. My name is Indra Felicius Moran. Here with the last digit of my student ID is 098. I'd like to continue the explanation about techniques and methods of Reiki. One of the key characterizing highlights of Reiki is that the capacity to rehearse is presented through an attunement process and isn't subject to any natural individual recuperating ability. Attunement is finished by a Reiki ace through a progression of ceremonies that are set to open the energy channels of the body. Attunement to the first degree of Reiki presents the capacity to treat oneself as well as other people by contact. Second Reiki gives the capacity to utilize explicit images to get to Reiki intellectually for far off recuperating. Attunement to third Reiki or the third Reiki or expert level presents the capacity to adjust others into Reiki. So at each level, the capacity to actually recuperate with Reiki grows continuously through committed practice. That's all from me. The next slide will be presented by my colleague. Thank you.
My name is Josephine Prasasti Wirawan with the last digit of ID number is 094. The benefit of Reiki. The purpose of Reiki therapy is to resolve emotional distress, which results in reduced pain, tension, and relaxation to the body. It can help reduce stress and anxiety, which can affect to the pain perception as well. According to Zadro and Stapleton, Reiki has an impact on stress, depressed mood, burnout, and anxiety. Reiki consistently has more effect than placebo in reducing symptoms of depression, anxiety, burnout, and stress. Reiki should be done with a certain period of time to get the effective benefit. A longer duration of treatment and higher number of applications can produce more larger effects to the patients and reduce the clinical symptoms of mental health.
Okay, my name is Bryan Tjandra and I'm going to explain. Hello, my name is Bryan Tjandra with the last three digit 152 and I'm going to explain the next chapter, which is scientific evidence of Reiki. So there are some research regarding scientific evidence of Reiki. One research have found that it could increase enzymatic activity and regulation of blood pressure. Other research found that the effects of Reiki for undergraduate students could help them with anxiety and depression. Another study explains that it reduces stress with biological indicators such as blood pressure, immunoglobulin, cortisol, anxiety, and many more. Another interesting study in another field, which is for elderly person, showed increase of relaxation, physical symptoms, mood enhancement, contentment, sleepiness, a need to learn more self-care, and many more.
My name is Putu Krishna Arsawardani Putri with last three digit number 027, and I will explain about the potential side effects of Reiki. There are no known side effects of Reiki. Therefore, it can be used as a cost-effective and safe complementary treatment in patients with various mental health conditions from all age groups. A study by NCCIH revealed that Reiki appears to be generally safe, with no observed adverse effect on recipients. There are no identified contraindications associated with Reiki. The technique of Reiki simply involves a light touch on the body or slightly above the body. Therefore, it is considered as a non-invasive, non-manipulative, and non-pharmaceutical complementary treatment. However, Reiki should not be used as a replacement for conventional medical or psychological treatment, as it only enhances and complements any medical treatment that patient is currently undergoing. On a rare occasion, patients may experience brief discomfort following a Reiki session. However, it is merely the body releasing stress and toxins as it returns into normal state.
Alright, thank you for the opportunity. Next is the chapter 3 for conclusion and advice. But first, let me introduce myself. My name is Joshua with my list number 205. Now I'm going to talk about conclusion. So Reiki aims to improve quality of life by acknowledging the multidimensional nature of human existence, including the energy field. Reiki is a complementary and supporting therapy to wellness and conventional medical care. It is also used in hospital and medical setting, as well as for self-care and family care. Reiki produce are usually performed by practitioner in a calm, quiet environment. That being said, the person can happen elsewhere. The purpose of Reiki therapy is to resolve emotional distress, which results in reduced pain, tension, and relaxation to the body. It can help reduce stress and anxiety, which can affect to the pain perception as well. Some research have made a systematic review and clinical trials on the effect of Reiki for mental health. The finding imply that Reiki can generate biochemical and psychological results right away consequences, like an increase in the enzymatic activity and regulation of blood pressure. There are no known side effects of Reiki, therefore it can be used as cost-effective and safe complementary and alternative treatment in patients with various mental health conditions from all age groups. Alright, that's all from me. For the next one, it's going to be presented by my friend.
So thank you for your time. My name is Nyoman Jana, last three digits of name number 011. Next slide, please. Okay, thank you. So I'm going to explain about the advice of this student project. With the conclusions of this paper, there are several things that are suggested by the writers. More research should be done on the topic of effects of Reiki on mental health. As has been mentioned on the paper, Reiki is one of the therapies that is rapidly developing and being introduced worldwide. Thus, understanding more about effect of Reiki on mental health, doctors and other healthcare professionals could prevent and treat mental health problems by choosing Reiki as one of the treatment modalities. I think that's all for me. Next slide, please. Okay, so that was the end of our student project presentations. Thank you so much for your time and for your attentions.